Okay, so this is Westy. We're going to demonstrate sort of a general physical examination. Some people go from head to toe, top to bottom, go in a systems-based approach like cardiovascular or gastrointestinal tract, different techniques. There's different ways to do an exam. I think it's helpful to sort of think about it from a practical perspective. When you're doing a head exam, for instance, you're in part doing an ophthalmic exam. You're assessing the musculoskeletal system of the head and part of the respiratory tract, and so you're evaluating multiple systems all at the same time. So from a practical perspective, we don't tend to do a systems-based examination. We tend to do it sort of based on the anatomy of the animal, looking at regions at a time, sort of with that soft focus, taking in all of the information about the animal as you do your exam. But you need to adjust your examination based on that particular patient. So if you, from history or on your initial exam, identify an abnormality, you might need to expand this general exam that I'm going to talk about now to do a more focused systems-based exam. If you know that the animal is presenting with respiratory symptoms, you may expand your general exam to look at the respiratory tract more thoroughly than you might on a general exam. If you notice when you're watching the dog walk in that it's paretic in the rear, then you're going to expand your exam to include more of a neurological examination than you would on a general examination. So you need to be able to be flexible and adjust your examination to expand as necessary for the patient. So in general, I start with the head because it's a way to greet the animal and get to know them. But if the animal happens to be one that's a little head shy or seems like they're uncertain about the examination, I might switch that around and start with abdominal palpation first. So you do need to be a little bit flexible. In general, I start with the head. And if you read any practice management journals, they recommend that you explain to the client what you're examining as you go so they get a perceived value for the exam. They don't realize all the value that you're providing. You know, the distinguishing factor between Dr. Google and a veterinarian is our physical examination skills. That's one of the things that can't be outsourced. And so that's why I think it's so important for you to develop excellent physical examination skills. And so I tend to start with the head, and although they recommend that you tell them what you're doing, in reality, you're looking at so many different things as you're doing the exam, you couldn't possibly tell the client all of the things that you're evaluating. Just petting him on the head, I'm getting an assessment of the integument and the musculature of the head, the symmetry, the bony structures of the head. At the same time, I got a palpebral reflex because he blinks when I bring my hand close to him. I can look at the eyes and get an anterior segment exam and see that his pupils are symmetrical. And if I'm petting him hard enough, you can see the whites of the eyes, and you can see that there's no conjunctival hyperemia, for instance, or discharge. So you're looking at many different layers all at the same time. But in general, I start by petting them on the head. Invading the mouth is a little bit more off-putting than some other parts of the head and neck exam, and I'm an oncologist, so I tend to check the lymph nodes next. So after I play with them a little bit, I look down the vertical portion of the ear canal on both sides, and as I'm doing that, I'm actually palpating the pinna, so I let it slide between my fingers, so I'm both palpating and looking, using all of my senses, smelling, palpating, and looking. Looking all at the same time. So after I've done sort of the top of the head and looked for asymmetries and looked at the nares for any discharge, I then tend to palpate the salivary glands and the mandibular lymph nodes. So again, for the salivary gland, just put your thumb lateral to the larynx and push straight back until your thumb hits longus coli, and the salivary gland always pops out, so you can feel the salivary gland. Then you'll slide your fingers rostrally off of that to feel the little lymph nodes that's right there. And I do the same thing generally regarding optimizing your conditions. It's easier to see asymmetries if you're directly in front of the animal. Same thing goes for palpating lymph nodes. If you have a restrainer, someone who can keep the dog from moving, you can palpate both salivary glands and lymph nodes at the same time, so you can compare them for a difference in size. So after I've done that portion of the exam when I'm in front of the animal, I actually turn my body so that I'm sort of beside them and I can restrain their head. So for an oral examination, the first part is to look at the external part of the arcade. So I typically put my fingers behind their canine teeth, so I have the whole head in my hand. And then I use my index finger on one side to slide and look at the entire external arcade on one side. And then on the other side, which will be harder for you to see, I lift up with my thumb and slide all the way around so I can see the entire external arcade. I'm also at the same time getting a capillary refill time. You can do that specifically, but as you slide your hand, you kind of, if you're paying attention, you get a capillary refill time as well. You're also getting an assessment of the hydration of the animal, at least one of the assessments, one of the parts of the assessment. So if you want to assess hydration, if we digress for just a minute, you want to check the moistness of the mucosa up by their largest tooth. That's where the salivary duct comes out. If you only check up here rostrally, if dogs are panting, the front of the mouth might dry out and make the dog look dehydrated when in fact it isn't. So you want to look at mucous membrane color and the viscosity of the saliva. Another assessment of hydration is just checking the skin turgor over the shoulder blades. It should snap back quickly in a normal animal. Remember that over-conditioned animals you can miss dehydration in over-conditioned animals because their skin snaps back just because of the high level of fat within their skin. And really old animals that have lost elasticity, like me, the skin doesn't snap back as quickly, and yet they might be normally hydrated. So you have to consider the patient when you're making these distinctions. So you want to look at their capillary refill time to assess hydration. You want to look at the saliva. You want to check the skin turgor, and actually you want to check the eyes as well. And this probably won't show up, but the dog should have a shiny line at the lower lid margin, the normal tear film along the lower lid margin. And if you are looking at the dog and its eye actually has an oily sheen to it, such that they've lost the aqueous portion of the tears, leaving the relatively a higher proportion of the oily portion of the tears, so the eyes actually look kind of like an oil sheen, that's a very dehydrated animal if they get to that point. Either that or they have dry eye. And so you want to look at the eye position. If it's sunken back, they might be more severely dehydrated. The moistness of the eye and the oral exam. The last thing for hydration would be on abdominal palpation, which we'll get to later. Animals that are very dehydrated, the organs inside don't slide. They feel doughy is the common term that's used. It feels stickier inside. So you use all of those techniques to assess hydration, as well as objective parameters like body weight and paxil volume. So a little digression there about hydration, but you're doing that as part of your head and neck exam. You're starting to assess hydration when you're looking at the dog. So I've looked at the whole external arcade and saw if there's any dental disease, made a note of that. The next step for me would be to do an intraoral examination. And most dogs don't mind you taking a look in their mouth. It is a little bit more private space for some, and so they're going to be a little bit more head shy. So you do need to be careful, and this is one of those places where sometimes, well, always, it makes a big difference if you optimize your conditions. You want to position the animal such that if you can just straighten them out, if the light when you open their mouth is going to be coming in at the right angle, such that in the little bit of time that you have with their mouth open, you'll be able to see the ridges of the hard palate, the soft palate, the fauces, and if you push on the base of their tongue, you'll see the surface of the tongue, and if you push on the base of the tongue, you'll potentially see the tonsillar crypts, and I often see epiglottis as well. But in order to be able to see all that, you need to have your head positioned such that you're not blocking your light, and you have to have the dog's head's positioned such that the light's going to come in and hit those structures and illuminate them so that you can see them in the little bit of time that you have. And so you would do it much more quickly than I'm doing here, but you're starting with your thumb and forefinger behind their canine teeth, so you're holding their head up, and then you're going to grab out into the incisors on their lower jaw and push down in order to open the jaw. Muscles will fatigue. If your thumb is strong enough and the dog's just trying to hold their mouth shut, you can eventually fatigue that muscle and open the mouth. My recommendation actually is to put your thumb on the incisor teeth, but actually hold on with your two largest fingers on the sort of on the symphysis of the mandible. So you're both pushing down and pulling up at the same time. So 60% down, 40% up. So you're actually holding on to the whole jaw. Because there are times when animals will hold their mouth very tightly and not want to open, and they'll fake you out. They'll hold tight, 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 and then they'll snap their mouth open and twist their head, and they get away from you very quickly. And so you don't get to see what you need to see. If you're actually holding on to the mandible, thumb on the incisors, fingers underneath, you can control how far down it goes and the speed at which they're opening their mouth. There are times that you choose not to open it wide, but actually open it only partially. Don't let them open it farther. And then you can change the angle of their head to allow the light to come in, and you can see all of the structures. You see that he just tried to open his mouth and move his tongue to get away, but I actually got a very good look at the roof of his mouth and the tongue and the lingual aspect of the arcade by only opening it partially. For animals that have problems with their temporomandibular joint or a tumor behind their eye, prying their mouth open is actually super painful because of the ramus of the mandible pushes forward and pushes into that space. And so opening the mouth only partially is a lot more humane. It's a lot less painful for the patient. Most patients don't have that problem, so you want to open their mouth wide. You want to push down on the base of the tongue and look at their tonsillar crypts and the rest of the structures in the back. So to do that, again, you're going to optimize your conditions by having the head at the right angle, holding on the top of the head. You push down on the lower jaw, and I'm going to actually reach in and push down on the tongue so that I can see those structures in the back. And I don't know if this will show up on this type of view, but I'm actually pushing down on the base of the tongue, and my head is just probably in the way of the camera, but just so I can see the tonsillar crypts. And if you want me to show you that, we can do that when you come up to visit oncology sometime. So my finger is all the way in there on the base of the tongue. I see plenty of veterinarians breaking rules and sticking their finger in between their teeth to look underneath their tongue like this. If you have a sweet dog like Westy, you can get away with that. You could have bitten me if you wanted to. That would have, dogs can totally nail you if you're doing that. So that's generally not a safe way to examine a dog, even though if you know the patient very well, you can potentially bend the rules a little bit. If you're making them gag, if you're going all the way in and pushing on the base of the tongue, it's pretty much impossible for a dog to bite you when they're gagging. And so if you're going to go for it, go all the way. If you're not going to go for it, don't go for it. And so just be cognizant you don't want to lose your fingers or get bitten. So go big or don't go. So that's sort of the head portion of the examination, and I did that mostly just in front of or beside the animal. Now I want to evaluate the neck and shoulders, and so I have to turn my body or move the dog such that I'm sort of beside them instead. And so to finish the rest of the neck exam, there's not much there, right? There's trachea, larynx, longus coli, and if the dog has a thyroid tumor, there would be a mass there. And unfortunately, thyroid cancer is diagnosed way too late because people forget that dogs have thyroid glands too. So you do need to palpate for masses or abnormalities in the neck. And the simplest way to do that is to hold your head in sort of a neutral position, slightly head slightly up. Put your fingers lateral to the trachea, and slide. I'll just move the collar up and slide all the way to the thoracic inlet. So I'm just pushing all the way down, and if you can see, the trachea just slides out of the way. It just moves. It's very flexible. You can move your larynx back and forth. It doesn't hurt, and there's really nothing there except for trachea, larynx, trachea, and longus coli. If, as you're sliding your fingers towards the thoracic inlet, there's a bump. If your fingers slide over a structure, that's abnormal. There's not supposed to be anything there. And so it might just be a lipoma, but it could be a thyroid carcinoma. So if your fingers find another bump in the neck, that's abnormal and it should be evaluated. So I do it on one side, slide all the way to the thoracic inlet. I do it on the other side with my other hand all the way to the thoracic inlet. It doesn't hurt. You can do it with the thumb and forefinger. You can just take one hand and slide all the way down. That works great on a cat. On a dog, you have to push pretty hard to get behind the trachea. And if you push that hard, some dogs will cough, which interrupts your exam. And so I think it's just more comfortable if you just use your fingers like this along the side. So for me, that works well. If I had not already palpated the prescapular lymph nodes when I was in front of the animal, then I would do that in this position, putting my my fingers in the jugular furrow on both sides, thumb along the lateral aspect of the brachiocephalicus. And I'm going to start dorsal and slide distally or ventrally until we get that lymph node blipping through my fingers. So that's how I evaluate that lymph node. So now I've done a head and neck exam, and we want to evaluate the entire body, the skin and musculoskeletal structures. And so novices tend to palpate kind of like, maybe we could switch positions now. They tend to kind of palpate like that intermittently, and you're much better off if you actually just slide your hands. And dogs just consider it petting. So you're feeling for lumps or bumps on the skin, of course, but also for asymmetries in the musculature and the bony structures, as well as reactions suggesting that the site is uncomfortable. So I just slide my hands along the entire dorsum of the animal, and then I'm going to do the same thing, sliding along the entire length of both limbs on animals that have had, for instance, cruciate ligament rupture. You can see from a distance that they may have one knee larger than another, but you also feel that thickening as you're palpating along the medial aspect of their stifles. And so you can compare one side to the other by sliding your hands ventrally on both sides. And so I'm going to do the entire anatomy of the dog, feeling for lumps or bumps, evaluating all of their musculature and their bony structures for any asymmetry. Again, this is a general exam, which would normally take me about 2 minutes and taking me an hour in this video. But you're going to expand that exam if you identify abnormalities. So if you saw that the dog had a lameness, then you're going to expand your exam to include an orthopedic exam of that particular leg after you've done the general part of the exam. So again, we're palpating the entire anatomy of the entire thorax and feeling for the axillary lymph nodes. And then along the ventrum, he's got a little scratch here. If it's a female animal, I also recommend that you, after you've done the sort of general palpation, feeling for any asymmetries for lumps or bumps, is to take each mammary gland and roll that tissue between your fingers, such that you're actually rolling that skin between your fingers to try and identify tumors when they're small. Most tumors less than a centimeter in diameter, mammary tumors less than a centimeter in diameter, are cured if you surgically remove them. If you leave them there, they have the potential to become more aggressive. So I roll each mammary gland through my fingers to check each one of them. So that would be an external exam of the trunk and neck. You need to also evaluate the perineum. And let's turn him this way, let's head that way a little bit. And this is a pet peeve of mine. I think that we need to remember the normal tail carriage of the patient. To take their tail all the way to vertical actually is super painful for some breeds. And this is where, generally you want to focus on the patient's comfort in order to be able to do your examination. And ideally you want it to be ergonomic for you. But this is one of those cases where it's not going to be ergonomic for you. You might have to actually get underneath in order to look up underneath the tail, because lifting the tail beyond this far is uncomfortable for many patients. And so you don't want to jack it all the way up. I think that's one of the reasons why dogs don't like to have their temperatures taken, is because people are not necessarily cognizant of what's comfortable for them in their normal tail carriage. So you need to change your position so that you can look up and evaluate the perineum, scrotum on a male, vulva on a female, the perianal area for swellings, discharge, masses. And as part of all of this sort of general exam, you're evaluating the skin, but you need to be specifically, try to evaluate the skin by pushing the hair backwards in several places to look for abnormalities like fleas, flea dirt, epidermal collarettes, like you might see with a superficial pyoderma. If you know the animal has allergies, you're going to be, in addition to the normal visual and palpation, you may have to turn them on their side in order to look at those areas that might be affected. Again, depending on the history of the patient and your findings, you may have to expand this general exam to look more carefully at other areas. Next, we'll talk about abdominal palpation.